hot flashes, mood swings, and now foot pain. If you're going through menopause, those aching feet aren't just in your head. Here's why it happens and what you can do about it. My name is Dr. Tarr. I'm a board-certified podiatrist in private practice in Phoenix, Arizona, and I own a small practice called Direct Podiatry Arizona in Tempe. So here are 5 reasons why your feet hurt during menopause. Menopause is when a woman's menstrual cycle or period stops. This on average happens in late 40s to early 50s. So during menopause, your levels of estrogen and progesterone, 2 key female sex hormones, drop. And these hormonal changes can lead to a lot of different symptoms in your body, including low bone density, joint pain, muscle stiffness. The foot pain that can come along with menopause can be a real issue for some women. And that can definitely impact your quality of life and what you're able to do pain-free. There are 5 reasons why you might be experiencing more foot pain with menopause. 1, your bones become weaker. Again, like I mentioned before, menopause can definitely affect the strength of your bones or your bone density, and this is caused by the drop in estrogen. Estrogen has a lot of different roles in the body. One of those roles is actually protecting your bones and maintaining your bones' health. So once those levels start to drop, you can start to experience brittle bones. Also, an important role of estrogen too is helping to support your body and making new bone or being able to heal injuries to the bone. So as your estrogen levels drop, less bone is being made. The cells responsible for making new bone become less active. Your bone density can become worse, your bones become weaker, and that can lead to health problems like osteopenia or osteoporosis, which can make the bones more likely to break and make it a lot harder to heal from broken bones. So second reason why your feet might be hurting during menopause, increase in inflammation or joint pain. The hormone changes that you're experiencing during menopause can increase your risk or can lead to body-wide inflammation and joint pain really all over your body, including your feet. Estrogen also has anti-inflammatory properties as well. So lowering estrogen levels can set you up for higher inflammation. This increase in inflammation can make any pre-existing foot problems you have worse or actually bring about new ones. Types of arthritis, especially osteoarthritis, can be common sources of foot pain in women in menopause. Arthritis can attack the joints in your feet, causing swelling, stiffness, pain, especially when you're standing or walking. So reason number 3 why your feet might be hurting more during menopause are changes to your weight or weight gain. So not all women going through menopause will gain weight, but it can be something that happens going above your body's kind of natural set point when it comes to weight. And that'll be different for everybody, especially gaining weight quickly can leave your feet unable to adapt to these changes. And that can lead to tendon and ligament issues, plantar fasciitis, that can lead to changes in your arch. And in some people, this strain can be so severe that their arch actually collapses. So the 4th reason why your feet might be hurting while you're going through menopause is actually poor circulation. So the hormonal changes that are seen with menopause can potentially make any circulation problems that you're having worse in your feet. Circulation problems can actually lead to foot pain, can lead to many foot problems. One of the many roles of estrogen is that estrogen can help to regulate blood flow by increasing the size of blood vessels inside your body, also known as dilation. So when estrogen levels fall, it can be a lot harder for those blood vessels to dilate and for enough blood flow to reach your feet. This can also increase your risk of something called peripheral arterial disease or PAD. So symptoms of PAD include pain, cramping, numbness to your feet and legs. Also, if it's harder for you to heal any cuts, any sores on your feet or legs, that can also increase your risk of developing an ulcer, which is a chronic wound or sore. Increase your risk of serious infection, hospitalization, and in worst case scenario, amputation. So 5th reason why your feet might be hurting during menopause are age-related foot changes. So similar to pregnancy where your feet actually can go up in size, menopause can actually do the same thing. It's not unheard of that a woman going through menopause, their shoe size will change. This is for a lot of reasons. Again, if you're having arch changes to your foot, that can change the size of your foot. If you're having swelling going on as well because of arthritis or just inflammation, That also can require you to have to buy a larger shoe than what you wore before. Losing muscle tone, muscle strength in your feet too, or muscle mass also can make you require a different shoe size than what you wore previously, especially with arthritis as well. Joints can become more stiff, more rigid. If you're not good at resistance training or flexibility training, these things also too can require you to buy a bigger shoe than what you needed in the past. Also, these age-related changes to your feet can increase your risk of sprains, strains, broken bones. So, what do you want to do if your feet are experiencing pain during menopause? You want to do things like be mindful of the shoes that you're wearing. If you're experiencing any pain with any specific type of shoe, don't wear those. Focus on the right shoes for your foot type, and that'll be different for everybody. Staying active, practicing foot exercises as well, stretching, strengthening your feet. If you're a woman that is not in menopause yet, these are things that you can start to incorporate into your daily life to help ward off a lot of these symptoms later on down the road. Be mindful of inflammation, avoiding inflammatory foods like highly processed, highly refined foods, refined sugars, trans fats. You definitely want to have a primary care doctor when you're going through this transition of life as well, because they will help you manage body-wide menopause symptoms. But if your foot pain is getting worse, you definitely want to see a podiatrist as well, because there are other options that we have for you in treating this foot pain. So story time, I had a patient, bless her heart. She was in menopause, came to me after suffering a fall, and she actually had 5 fractures, 5 bone breaks in her foot. So for me, managing her healing process with her foot was key, but also she didn't have a primary care doctor to manage her other menopause symptoms. So I sent her to a local doctor here in Tempe for that. Again, managing menopause, it usually will require multiple doctors, especially if you're having foot pain, but you can get your quality of life back. These are my 5 reasons why your feet are hurting during menopause. Let me know in the comment section below. Are you someone going through menopause? Have you gone through menopause and you were dealing with foot pain? What changes did you notice in your feet? What helped make the pain better or worse? Let us know in the comments. If you liked this video today, give me a like. If you would like to see more content from me, feel free to subscribe and hit that notification bell so that you'll be notified whenever I post a video. I also will leave a blog post in the description box below about this topic. I also will leave a email newsletter link. Feel free to click on that if you would like to receive weekly content from me. Until next time, everyone, wishing you good health, take care, and bye.